Welcome. We're living longer, and that surely is a good thing.
Well, it is a remarkable achievement that our lifespan is increasing. However, if you look at our health span, so the number of years that we spend healthier, it's actually trailing behind. And this is where the challenge is coming from. We need to start thinking less in terms of lifespan and living longer, but it's all about living longer, healthier.
What should companies in the healthcare space be doing to bridge that gap between the lifespan and the health span that you talked about?
Yeah. So if we think about healthcare companies, there is a huge shift that's required as we move from thinking mostly about sick care and focusing more on prevention. Prevention needs to start in a different point in time, and hence we need to start thinking about our people not only as patients but also as consumers and apply methodologies accordingly. So we know what we need to do to drive adoption, retention, to improve customer experience. These are the methodologies that we can use. For example, bringing in customer journeys, right? So think about your longevity journey, think about different personas and behavioral archetypes, as well as moments of truth. So figuring out when is the right point in time to bring in this intervention, like a health check, for example.
So that's businesses or companies within the healthcare space. What about those outside? What can they be doing?
In the healthcare space, it's a major change that's required. But imagine we would also think about policymakers and insurance companies, for example, and they will stop thinking about healthcare solely as a cost matter, but they'll start thinking about it as an investment, as many begin to do, actually. So this is the next shift that is required, going into this space and considering this a business opportunity and considering this a great space to invest.
What would the ideal then in the future look like?
So in the ideal future, we will move from thinking and focusing mostly about lifespan to focusing more on the health span, meaning we will move from focusing strictly on sick care and bringing in prevention, bringing in customer experience and not only patient perspective, hence creating data which we currently don't have, as we need also to drive most innovative AI solutions. So this is the next step, as well as making sure that we are moving this whole discussion from a cost discussion into an investment space, and hence bringing in all the customer experience methodologies and behavioral design into this.
So interesting. Thank you so much for joining us.